As we talk about COVID-19, we certainly are marking a somber anniversary in this country. It has been exactly 1 year since Canada's first case of COVID was confirmed.
Here to announce our first presumptive positive case of novel coronavirus that we were just made aware of earlier today.
The case is in a male who's in his 50s. He had traveled to Wuhan, China, and come back, and within a day became quite ill. And the emergency service was aware of his travel history, used full precautions, was taken to Sunnybrook Hospital, and is now in a negative pressure room.
And so much has happened since then. Almost 750,000 infections, nearly 20,000 deaths, multiple provincial lockdowns, an economic meltdown, and starting last month, a vaccine rollout. Well, there's still a lot of questions about how well this country actually handled the outbreak over the past year and if more could have been done. Now, Mike Crawley, of course, covers Ontario provincial politics for the CBC. He's written an article on our website that looks back at the past year, also the state of the pandemic as we look at it today. Mike joins us right now in Toronto. Mike, good to see you. Now, you've been speaking to medical experts about the handling of this crisis. And as we mark this anniversary, let's go back to the beginning. What are they saying about how well Canada dealt with the early weeks of this pandemic?
Well, Michael, they point out that scientists were learning about the coronavirus in real time and having to try to apply that knowledge, immediately, as quickly as possible. And in those early days, the thrust of the messaging coming from officials was, as much about, or maybe even more about, trying to calm people's fears about the virus than it was, preparing them for, what eventually happened. There was a big emphasis in the beginning on screening people for symptoms, and yet, as we now know, the virus was being spread before people were showing any symptoms. I spoke to Dr. Zain Chagla about that.
Had we known clearly that there was pre-symptomatic transmission, I think the way we would have handled things would have been much different. I mean, I think the way we would have dealt with people coming back from the border during March break in February likely would have imposed some sort of period of quarantine on them to minimize spread within our communities. I think the way we traced cases would have changed significantly, and ultimately things like considering universal masking.
Dr. Chagla said that when it became obvious that COVID-19 was spreading across the border in the US, it was clear that it was going to be spreading within the community here in Canada, and that the country didn't pivot quickly enough to that type of transmission.
Mm-hmm. So a lesson perhaps to be learned out of that. But, as we talk about lessons learned or not learned, let's also talk about long-term care facilities, because we know over this past year, the majority of Canadian COVID deaths have been in these congregate living settings.
And that's still happening as well in the second wave. In Ontario, the death toll in long-term care now totals more than 3,300 people. I spoke to Dr. Isaac Bogosh, and he said it should have been obvious to people from the very beginning how vulnerable people were in long-term care.
What's really tragic is how it unfolded in the first wave. And of course, what's more tragic is how it's unfolding in the second wave now, because there certainly could be steps taken between wave one and wave two to significantly protect the most vulnerable population among us. And, it's awful. It's absolutely awful to watch.
Now, Michael, last thing I want to mention is here in Ontario, the death toll from COVID-19 overall is approaching 6,000 people, and the number of people who have died in the second wave is already higher than the number who died in the first wave.
Mike, we continue to follow all of this. Thank you for that. Our Mike Crawley in Toronto.